Good morning, everybody. Today's class is about the extra genitalia, that is a female genitalia. We will be seeing about the internal genitalia, about the ovary, fallopian tube, and the uterus. So, when we are starting about that of the female genital groups, so what we come across. So, this is the specimen what we are seeing here. So, this is a specimen. So when we see it in the female genitalia, it consists of two. The genitalia includes two, that is the external genitalia and the internal genitalia. So here in this specimen, you can see the internal genital organs. So this is what we will be seeing the internal genital organs. So the internal genital organs includes ovary, fallopian tube, uterus, followed with that of the vagina. So you can see here in this specimen, you can see the pair of that of the ovaries. So these are the pair of ovaries, almond shaped structures which are present in the pelvis. So whole of that of your organ is in the pelvis. So these are the pair of the female gonads. These are a pair of that of the ovaries which are present on the either side of that of the uterus. So this is what we will be seeing it. So this is one and this is the other. Next, following the ovary, the almond shaped structure, we can see a tubular structure. So this is a tubular structure on the either side of that of the uterus. So this tubular structure is called as fallopian tube or the oviduct. And in the center, in the midway, you are seeing a pear-shaped organ which is called as a uterus, which continues as that of the vagina. So these are the organs of the female reproductive organs, so which includes as that of the internal genital organs. So these comes under that of the internal genital organs: ovary, fallopian tube. So this is that what you are seeing is that of the fallopian tube. Yes, and this part organ what you are seeing is that of the uterus, which is, so this is that of your cervix. We will be seeing in detail also. So this part which is continuing, this is the posterior wall of the vagina. So this is thing what we will be seeing. Now we will be discussing in detail about that of the each organ. So first let us start with that of the ovary, that is the female gonad. So this is that of the ovary which is present in the ovarian fossa. So when you see the external features of this ovary which is present in the ovarian fossa, its length is about 3 centimeters in length. So this is the 3 centimeters in length and 1.5 centimeters in thickness. And it is situated in a fossa which is called as that of the ovarian fossa, which it is where it is situated. Now, when we see the ovary, when you are seeing it here, when you see the ovary, you are seeing it is in the horizontal position. Whatever the position of the ovary varies whether the woman is nulliparous or multiparous woman. If the woman is nulliparous, the ovary would be present in vertical position. So the ovary would be present in vertical. But when the woman is in the multiparous, then the ovary is present, it is situated in that of the ovarian fossa, it is in the horizontal. So you can see here the horizontal position of that of the ovary. So this is the horizontal position of that of the ovary what you are seeing it. So ovary, the position varies whether it differs from the women, whether she is nulliparous or multiparous, means the woman is having kids or not. So if the woman is not bearing any of the children, then she is considered to be a nulliparous woman. So at that time, the ovary will be in vertical position. If the woman has kids, she bears child, yes, then this ovary will be in horizontal position. So this is about the position of the ovary. Now coming to the parts of the ovary. The ovary consists of two ends. So this end is called as uterine end and this is the tubal end where you can see the fallopian tube. So this is called as a tubal end. This is the uterine end of the ovary. And next, coming to that of the borders, there is two borders. One is the attached border where you can see the meso-ovarian, which is a part of the broad ligament, but that is a posterior layer of the broad ligament which is attached to this ovary. This is called as meso-ovarian, which is an attached border. This border, which is convex border, is the free border. So these are the two borders, that is the attached border and the free border. Two surfaces. One surface is a medial surface. The other surface is a lateral surface. So this is a lateral surface of the ovary, and the other part is that of the medial surface of the ovary. So this is a medial surface of the ovary. Yes. When you see in detail about each thing, about each part, what it consists of, when you come across that of the ends, so this end, so this is the uterine end, so this end is the uterine end of the ovary, we can see, so it is related, so this uterine end is attached to that of the uterus, it comes in communication with that of the uterus at the part of the fundus and the body. So this is the fundus of that of your uterus and this is the body of the uterus. So at the angle of the uterus, so this end will be communicating with that of the uterus. So this end is called as the uterine end of the ovary, which is normally when you see the diameter, it is about 1 mm in that of the diameter. So this is the uterine end of the ovary. Now coming to that of the other end, that is which is called as the so this is the uterine end. The other end is called as, so this end what you are seeing is called as that of the, so this is the end what you will be seeing. So this is the end which is called as that of your tubal end of the ovary. So this is a tubal end of the ovary. The tubal end of the ovary is tube, it is called so because it is related to the fallopian tube. So this part what you are seeing is a fallopian tube, and this end what you are seeing is called as a tubal end of that of your ovary. When you compare the thickness from the uterine end, which is at the cornu of the uterus, or the angle of the uterus. So this is the angle of the uterus. So this is considered to be the angle which is present between that of the fundus and that of the body. So when you compare the diameter to the thickness of the two ends, the uterine end is comparatively thin when you compare with that of the tubal end of the ovary. So this is about the two ends of the ovary, uterine and the tubal end. Uterine end towards the uterus, so it is called as uterine end. Towards the fallopian tube, so it is called as the tubal end of that of the ovary. Now coming to that of the two borders, as we have said, there are two borders. One is that of the free border, this is the free border, and this is the attached border of that of the ovary. When you see the attached border, so this is the attached border of the ovary which is attached to the meso-ovarium. So the meso-ovarium is a part of the broad ligament. The broad ligament is one of the false ligament. The broad ligament consists of some part which is called as meso-ovarium, mesosalpinx, mesometrium. The meso-ovarian is that part of the broad ligament which is attached, which is a posterior layer of the broad ligament which is attached to that of the attached margin. So this margin is called as a attached margin of the ovary where it is attached to the meso-ovarium. So this is called as meso-ovarium, which is a part of that of the broad ligament. Next, after the meso-ovarium, so this is the attached margin. The next, opposite to this margin, what you will be seeing at this part is the free margin of the ovary. So this is a free margin which is a convex margin. This is the free margin of the ovary. Now coming after the borders, let's see that of the surfaces. When you see the surfaces of the ovary, as we have said, there are two surfaces. One is called as a medial surface, one is a lateral surface. The lateral surface of the ovary lies in a fossa which is called as a ovarian fossa, whereas the medial surface of the ovary is in relation to that of the tube. So this is called as that of the fallopian tube or that of the oviduct which is present. So this is the medial surface which is related to that of the oviduct or that of the fallopian tube. The other surface what you will be coming, so this is the medial surface, this is a lateral surface which is lying in a fossa which is called as that of the ovarian fossa. So this is about that of the ovaries, which is that of the external features of that of the ovary. Other than that, yes, we knew the blood supply and the venous drainage, that is the ovarian artery which is supplying to the top of the ovaries which are present, nerve supply sympathetic and parasympathetic which is present. But coming what we have seen here is only about that of the external features of that of the ovary. So we have come across to see the only the external features of that of the ovary, which includes that is of that of your two ends, two borders and that of the two surfaces what you will be seeing it. So before closing the ovary, I would like to repeat it again. I would like to show again the two parts of that of the ovary, that is the external features of the ovary. So then we can go to the other part of the genital organs, that is the fallopian tube. So when you see that of the ovary, yes, yes. So these are that of the ovaries that you are seeing it. So when you see that of the yes. So when you are coming across here, yes, you can see the here the ovary. When you see the ovary, as we have discussed, so those are the fallopian tube. This is that of the uterus. I am repeating my video again. So we can conclude the video by showing again, repeating again the parts, means what are that of your ends and surfaces of that of the ovary. So just to do that one, yes, when you are seeing it, yes, this is that of the ovary what you are seeing, which is called as that of the female gonads. So when you see each ovary, so this is the each ovary what you are seeing it, which are present on the either side. So each ovary consists of, so this part, so it consists of two ends. The one end is called as that of the uterine end of that of the ovary. This is the uterine end. So the other end what you are seeing is the tubal end. So this is what you are seeing it. So this is the uterine end of the ovary. The other opposite end is called as the tubal end of the ovary. Next, two borders. So this is a fallopian tube. So because of which we call is the tubal end of the ovary. And coming to the borders, there are two borders. One is the attached border and one more is a free border or the free margin. The attached margin is attached to that of the mesoovarium. So this is a mesoovarium, which is a part of that of the broad ligament. So this is part is called as mesoovarium. Opposite to the mesoovarium, what you are seeing is a free border. So this is the free margin of that of the ovary. Next, these are the two borders. Now coming to the surface, this surface which is in relation to the fallopian tube is called as the medial surface of that of the ovary. So this is the medial surface of the ovary which is related to that of the fallopian tube. This is the lateral convex surface which lies in the fossa, which is bounded by that of in front is the obliterated umbilical artery, behind is that of the iliac vessels which will be present. So it lies in a fossa which is called as that of the ovarian fossa. So this is about the ovary. Next, after the ovary, let's see about the fallopian tube and that of the uterus. So when you are seeing, so this is the tubal organ which is present on either side of that of your uterus. So this is what you are seeing it. On either side you are seeing a tube. So this tube what is extending. So this is called as a fallopian tube or that of the oviduct, or it is also called as a uterine tube. When you see the course of that of your fallopian tube, so here this is that of the fallopian tube, you can see it is extending laterally. So when you are seeing it, so when you are seeing the course of the fallopian tube, the whole of the fallopian tube is tortuous, so it is curved. When you are seeing it, so you can see that curvedness. The curvedness is because of when you see the pelvic inlet is much smaller than that of the length of the fallopian tube. When you knew that the fallopian length is about 10 centimeters in length, but coming to that of the cavity of the pelvis, it is much smaller. To accommodate this uterine tube, it has undergone that of the curved course. So when you see the course of that of the fallopian tube, here you can see it. The course is, it extends laterally upward. So when you are seeing it, yes, so it is extending laterally and upward. So this is laterally, upward, backward and downward. So this is a curved course of the fallopian tube. So again I am repeating the course of the fallopian tube. So this is lateral because either side of the uterine tube is present laterally to that of your uterus. So it is laterally upward, you can see the upward, then it comes to that of your backward, it goes to that of your backward and comes downward, attaches to that of the tubal end of that of the ovary. So this is the course of that of the fallopian tube. I think when we are catching at this position, you can see the course very nicely going laterally upward, then backward. This is that of your backward course because you can see the ovary here, and then coming downward attaches to that of the tubal end of that of the ovary. Now coming to that of the coming to the fallopian tube, what are that of the external features of the fallopian tube? The fallopian tube consists of two ends, means two ostia are present. One is called as that of your uterine ostia. So this is called as uterine ostia. This is called, what you are seeing is the abdominal ostia, which is opening into that of your abdomen. So because of which the peritoneum in the females is called as open. So which is communicating with that of the peritoneum. So what you are seeing, this is called as that of your uterine. This is called as that of your abdominal ostium. The uterine ostium, what you are seeing, so this is that of your uterine ostium, which is present at that of the junction of the fundus and that of the body, and this part what you are seeing is called as the abdominal ostium. So this is what you are seeing is the abdominal ostia. So these are the two ostia which are present at the two openings of the fallopian tube which are present. Now coming to the parts of the 10 centimeters long parts of the fallopian tube. The first part what you are seeing here, it will be within that of the uterus, so which is called as a intramural part of that of the fallopian tube. So this is the intramural part which is about only 1 mm. Most of the intramural part which is present within that of the uterus, within that of the fundus of that of the uterus which is present, which it opens at the junction of the fundus and that of the body. So which is only about 1 mm. It is a communication to that of the uterus. Laterally the uterus is communicating laterally by that of the fallopian tube. So what part of the fallopian tube is the intramural part of that of the fallopian tube, which is about 1 mm in length. After the intramural part, next part is what you are seeing here, the thick cord-like structure. So this is the thick cord-like structure. What you are seeing, this is about 3 centimeters in length. Again we'll go, yes, that is 3 centimeters in length, which is like a cord. So this is what we are saying is like a cord. This is 3 centimeters in length, which is called as that of the isthmus. So this is the isthmus, which is about 3 centimeters. It is thicker. When you see it is thick in that of the musculature, so this is the thicker. This is 3 centimeters in length. After the isthmus, the next part in that of the fallopian tube is called as that of the ampulla. So this is the ampulla. This is that of your isthmus. Next, after this isthmus, which is a connecting link, isthmus is called as a junction also, connecting link. Yes, this part which is dilated part. So this is the most dilated part you can see here. Yes, I am trying to show the dilated thing only. So this is the part what you are seeing. The most dilated part at this part, it is called as the ampulla of that of the fallopian tube. So this part at the earlier is called as that of the ampulla. So that is, ampulla is about 5 centimeters in length. What it is showing now is the infundibulum, which is about again 1 centimeters in length, and you can see that finger-like extension. So this is a finger-like extensions which is called as fimbriae. Among that, one of the fimbria is longer, which is called as, which catches that of the ovary, which is called as ovarian fimbria. You can see it is attaching to that of the ovary. So these are the parts. Again I am repeating. So this is the intramural part of the fallopian tube. After the intramural part of the fallopian tube, what you will be getting? So this is that of your ostia, that is uterine and the abdominal ostia. Yes, these are the two ostias or the two openings of that of the fallopian tubes. Yes, now, yes, now come. So this is the ampullary end. I think now you can see it. So this is the ampullary end of that of your fallopian tube. So this part is that of the ampullary end of that of your fallopian tube. Now as it is, you have seen in the posterior side of the uterus, because this is the posterior side. When you are seeing the uterus in anatomical position, we can see it. When you see in front, I think you can see, so this is in front, we are seeing the fallopian tube in front. So what you can see the course of the fallopian tube, because uterus in position, this is the anterior surface of the uterus. So when you see the course, I think you can see also the curved course, as we have discussed, laterally, upward, next backward, then it is going downward. I think you can see the course very nicely at this part. And one thing here, what you can see is the parts of the fallopian tube. The parts which is, so this is the ampullary end, which is about 5 centimeters in length. This is the infundibulum part, which is 1 centimeters, and this is what you are seeing is the isthmus, which is about 3 centimeters in length. Yes, that is what you are seeing is that will be that of your intramural part. Here what you are seeing is the abdominal ostia. Around the abdominal ostia, you will be seeing that of the finger-like projections. The finger-like projections are called as that of your fimbriae. Yes, among this, one of the fimbria is longer, which is called, which attaches to that of the ovary. Which attaches to that of the ovary. Yes, this is the ampullary end of that of your fallopian tube, which is about 3 centimeters. It is most dilated part of that of the ovary. Yes, when you are speaking about the, normally when you are speaking about the ampullary end of that of the fallopian tube, yes, this is the ampullary end of that of the fallopian tube. When you are speaking about the ampullary end of the fallopian tube, which is most dilated part of the fallopian tube, most of the time the fertilization, normal fertilization undergoes at that of the ampullary end of that of the fallopian tube. So this is where it is. Now after the fertilization, the ova passes after here, it passes from that of the fallopian tube, coming to that of the stages, it passes to that of the fundus of that of the uterus. So what we are seeing here, I think you can see the abdominal ostia. Surrounding it, you can see the fimbria. So where you can see one of the fimbria is longer and it is attaching to that of the ovary. What you will be seeing, this is that of the ovary. What you are seeing, the main function, yes, what it was shown is it passes that of the fertilized ovum from that of the ampullary end to that of the uterus, to that of the posterior wall of the uterus. Normally the fertilization or the implantation takes place at the posterior wall of that of the uterus. Yes, and so this is, if the fertilization, this is a normal part of the fertilization. If the fertilization is not happening at the ampullary end, it is happening at the, it is not transported. Normally what is the function of the fallopian tube is, the ova which is formed from that of the ovary is carried via fallopian tube to that of the uterus. But if it is not going in that way, means if it is not passing from the fallopian tube to the uterus, then there what happens is the ectopic pregnancies. Other, it is also called as a tubal. Normally it should go in this way, but if there is anything, if the patency of that of the fallopian tube, what we are seeing, so this is the fallopian tube where we see the, also the passing the dye, we see the patency of that of the fallopian tube, which is called as histosalpingography or histosalpingogram, because we pass a dye and see the patency or the sterility of that of the fallopian tube is seen. Which if the on other places, if the implantation takes place, it is called as ectopic pregnancies. So that is what I am showing there. Now coming to the relations of the fallopian tube. When you see the relation, so this is a fallopian tube. So this is a fallopian tube that you are seeing it. The relation, this is anteriorly. Anteriorly, it is anterior and in front and below. It is related to the round ligament of the uterus. So this is what you are seeing is the round ligament of the uterus. Posteriorly and below, both are below only. Posteriorly and below, it is related to the ligament of the ovary. So this is the posterior surface of the uterus. So posteriorly and below, it is related to the ligament of the ovary. Anteriorly and below, or in front, it is also in front and below, it some books are saying in front and below, or anteriorly and below, it is related to that of the round ligament of the uterus. So anteriorly what you will be seeing is the round ligament of that of your uterus. Yes, this would be the round ligament of the uterus. Behind posteriorly what you will be seeing is the ligament of that of the ovary. So these are the relations. Other than that, it is also fallopian tube is also related to that of the ovarian and that of the uterine vessels. So this is about that of the fallopian tube, about 10 centimeters long fallopian tube which is present on the either side of that of the uterus. Yes. After this, let us start about the anatomy of the uterus. After the fallopian tube, the next internal genital organ is that of the uterus. So this is that of the uterus which is a pear-shaped organ. So this is a pear-shaped organ. Yes, female. In female it is a child-bearing organ also. So when you see the uterus, yes, so this is, so when you see first where it is situated, the uterus which is pear-shaped organ, which is inverted pear-shaped organ, which is situated in the lesser pelvis. It is situated in the lesser pelvis. It is present obliquely. What we are seeing, it is, do remember, it is not present in the straight. It is situated obliquely. When we are seeing, it is situated in obliquely in that of the lesser pelvis. Yes, it is situated obliquely in the lesser pelvis. You can see here. Yes, great. So this is what we are seeing here. So this is the uterus that you are seeing. Yes, when we are it is situated obliquely in the lesser pelvis. So this is the fundus of the uterus. Yes, so this is the body of that of your uterus. But next we will be seeing it, but just to see, because you have to know the anatomical position, how it is present in the body. So fundus, body, and the lower part what you are seeing is, that is, will be continuing as that of the vagina. At this part we will be getting that of the cervix is present. So when you are seeing that of the uterus is situated between the two, that is urinary bladder in front and the intestine, that is sigmoid colon behind. So when you are seeing here, so this is the posterior surface of the uterus and this is the anterior surface. The anterior surface of uterus is that of the flat surface. Yes, when this is present obliquely in that of the pelvis, in the lesser pelvis, in front is the urinary bladder, and this fold what we are seeing is a peritoneal fold, and this is called as a pouch which is called as utrovesical pouch, which is the fold of the top of the peritoneum, which is extending from the anterior flat surface of the uterus to that of the urinary bladder. So this pouch is called as utrovesical pouch, which is also one of the false ligament of the uterus. So this is in front. So in front the uterus is related to that of the urinary bladder. Behind, when you see, behind it is that of the rectum. So between that of the rectum and that of the uterus, the pouch which is present is, means the fold of the peritoneum which is present, is called as rectouterine pouch or pouch or Douglas pouch. So that is present posteriorly. So uterus is present in the body obliquely between that of the two pouches. One pouch is called as that of your utrovesical pouch. One more is called as a rectouterine pouch. So it is present between the urinary bladder in front and rectum behind. So that is the situation of that of the uterus. Now coming to that of the position of that of your uterus. What is the anatomical? Any organ, the anatomical position is important. As we have said, the uterus is present obliquely in the lesser pelvis between the urinary bladder in front and rectum behind. So when you are catching the uterus, catch the uterus in such a way that this is the fundus. Yes, this is the fundus which is present above the edge of your uterine tube. So fundus comes forward. So it faces forward. The convex part of the fundus comes forward and faces the forward. The convexity faces forward. This is one. Next, as we have said, this is the anterior surface of the uterus. The anterior flat surface of the uterus should come forward, and when you are, so this is what we are seeing is forward and the top the backward, downward it is going. So forward and downward. So what we call is, uterus has two versions, that is, one is called as anteversion, one more is called as anteflexion. Anteversion, the uterus in relation to that of the vagina, it is about 90 degrees. It is about 90 degrees. So anterior surface, when you are seeing, this is the anteversion of the uterus, which is in relation to that of the vagina. You can see the anterior surface facing forward, and when you are seeing, it is facing downward. When you see the posterior surface, this is the posterior surface of the uterus, it is facing backward and upward. So this is what, so in body it is in this way. So in situ, in the position, so I am repeating. So this is the fundus. The convex surface of the fundus should face forward. Next, coming to that of the anterior surface, the anterior surface, the forward, it is forward and that of the downward. Posterior surface, backward and upward. So that is the position of the uterus in situ in our body. So when you are saying the uterus has two axes, one is anteversion, which is in relation to that of your vagina. So anteversion, the long axis of the uterus in relation to the vagina, which is about 90 degree. So in that way we are flexing. So that is, in what we are saying is the anterior surface of the uterus is facing down forward and that of the downward part. Next, so this is part what we are saying is that of the cervix. Cervix continues as that of the vagina. So the long axis of the uterus in relation to that of the vagina, it is about 90 degrees, which is called as a version, that is anteversion. So it means in relation to that of your vagina. So this is the about the anteversion. Now coming to that of your anteflexion. Uterus is itself flexed. Anteflexion, the uterus itself it is flexed here at this junction, which is called as isthmus, where you get that of the internal os. So this is anteflexion, which is about 120 degrees. So this is anteversion. So back what we are seeing is called as that of the anteflexion. Anteversion in relation to vagina. Anteflexion. So uterus is itself kinking. You can see that a bend at that of your isthmus, which is called as anteflexion. So this is about the position of the of your uterus. So when you are holding the uterus, hold the uterus in such a way, yes, in such a way that fundus comes forward, convexity comes forward, anterior flat surface. The anterior flat surface faces forward and downward. Flat surface forward and downward. That completes your anteversion, which is in relation to the vagina. When coming to that of your, so this is that of anterior surface. When you are seeing the posterior surface, the posterior surface faces backward and that of the upward. So this is vagina, what I am going to show, that is that of your vagina, cervix part. So this is that of your posterior wall of that of the vagina, what we are seeing it. This is the cervix part. This part what you are seeing is that of the cervix. So when you are seeing anteriorly, it is facing forward and downward. So this is that of your, after this what we will be seeing is that of the vagina, you will be getting it. So this is that of your anteriorly. When you go to the posterior side, the posterior side surface, you can see that it is backward and upward, the posterior surface, and this is called anteflexion. It is flexed at this junction. So this is the anatomical position of the uterus in a normal. Normally it is. Sometimes it might be also dextro and levo rotation. If the fundus comes, when it comes to that of the dextro, it comes about to the position that is that of your lateral wall of that of your pelvis. We will be saying it. It can be dextro and that of your levo rotation also. So this is about that of the position of that of the uterus. Now coming to the parts of that of the uterus. The part above that of your, when an imaginary line is drawn from the one uterine, that is the ostia of one uterine tube. These are the two uterine tube what we are seeing it. So this above this one, what you will be seeing that of the fundus of the of your uterus is seen. Before that, let's see that of your dimensions of the of your uterus. When you see each uterus, it is about 7 centimeters in length. Yes, this is about 7 centimeters in length and 7.5 centimeters in length. Breadth is about 5 centimeters in breadth. Thickness is about, when you see the thickness is about 2.5 centimeters in thickness. Weights about 30 to 40 grams in weight. So that is the dimensions of the uterus. 7.5 into 5 into 2.5 centimeters. But when coming to the cervix itself is 2.5 centimeters in length. Yes. Now coming to the parts of the of your uterus. The parts of the uterus is, these are the two uterine tubes on either side, which is called as the ostia uterine. So above that, when an imaginary line is drawn from one to the top, the one uterine tube to the other, yes, above that the part, the space is called as that of the fundus. The fundus is facing, it is a convex surface. This is a convex part of the fundus. In the fundus, there is no cavity, there is no uterine cavity. Remember, there is no uterine cavity in that of the fundus. One more thing, the importance of the fundus which is present above that of your uterine tube is normal implantation takes place on the posterior wall of the fundus. So that is about the fundus of the uterus. So when that is one in one side we are seeing, when you see the behind next part, that is the body of the uterus. So this is the body beneath that of the uterine tube. So these are the uterine tube. So above is the fundus. The above the uterine tube is that of the fundus. Below the uterine tube, from the lower border of the uterine tube to that of the isthmus, yes, is called as the body. So this part is called as the body of your uterus. So this is called as that of the body of the uterus. So when you see once back also, so this is what we are calling as the body of the uterus. This part what you are seeing is that of the fundus of the uterus. So the body extends up till that of the constricted part, which is called as that of the isthmus. Up till that part it is called as that of your isthmus. So the body extends up till that part. Beneath that part it is called as that of the, beneath that of the constricted part, it is called as that of the cervix. So this part, so this is the called as that of the body. So this body extends up till that of the isthmus part. The isthmus is the constricted part of that of the uterus bit. Let us go behind. Yes, above this is that of the fundus, beneath that of the uterine tube. So beneath the uterine tube, what you will be seeing is at this part will be that of the fundus of the uterus. When you see on the posterior side, yes, on the posterior side, so this is the fundus. The fundus extends from below that of the uterine tube to the constricted part. This is called as the isthmus. This is the constricted part of the uterus where internal os will be present. So this part is called as that of the fundus of the uterus. So this is the fundus. Beneath this constricted part, what you will be seeing, so this is that of the fundus. So beneath this constricted part, what you will be seeing is the called as a cervix of the uterus. When we see the body of the uterus consists of anterior surface is present. This is the anterior surface of the body. Behind is a posterior surface. So this is the body. The body consists of, above is that of the fundus. So this is the body of the uterus. So within the body consists of anterior surface, posterior surface, and two borders, that are the two borders where you can see the attachment of the broad ligament, which is the borders are not attached by means of, not covered by the peritoneum, it is attached by the broad ligament. The anterior surface of the uterus, which is a flat surface of the body of the uterus, is related to that of the urinary bladder. Whereas a posterior surface of the uterus, which is convex, the posterior surface is convex, which is, it is related to the posterior, this is the anterior surface. The anterior surface is related of the body of the uterus is related to that of the urinary bladder. Yes, when you come across a posterior surface of the uterus, the posterior surface is related to that of the large intestine, that is a large intestine and small intestine, that is related to the sigmoid colon. So this surface is also called as, so it is also called as vesical surface. The posterior surface is also called as intestinal surface. When you come to either side, these are called as a lateral border. You can see to the lateral border, you can see the attachment of the broad ligament. So this is the attachment of the broad ligament, which is extending from the lateral border of the uterus to that of the pelvic wall. It is attaches to that of the pelvic wall, lateral pelvic wall, which will be attaching. So it extends from the lateral wall of the uterus. So this is a broad ligament of the uterus. When you see the broad ligament, which is present in the lateral side, lateral border, which is attaching the lateral border of the uterus, what does the broad ligament of the uterus consists of? When you see from above downwards, it consists of, the first one is that of the fallopian tube. So this is what we have seen is that of the fallopian tube. The curved part, what you will be seeing is that of the fallopian tube. Next to the fallopian, anteriorly, what we have seen earlier, yes, this is that of the fallopian tube that you will be seeing it. Next to that of the fallopian tube, this is called as a round ligament of the uterus. So this is the fallopian tube. The constituent of, I am saying the constituent of the broad ligament, that is first is the fallopian tube. The next is that of the round ligament of the uterus. This is anterior, the anterior surface. Posteriorly, you can see the ligament. Posterior and below is the ligament of the ovary. So that is a constituent of the broad ligament. Other than this, what you will be seeing is uterine and the ovarian vessels, anastomosis of uterine and the ovarian vessels, plexus, there will be nerve plexus, lymph nodes and lymph nodes will be present with the amount of that of your myometrium which is present around, or perimetrium which is present in that of the broad ligament of that of your uterus. So this broad ligament, when you are saying it, we have said the ovary is attached, the posterior layer of the broad ligament, the one which is attached to the ovary is called as mesoovarium. The one which is present between the fallopian tube and that of the ovary is called as mesosalpinx, and around that of the uterus on either side of the uterus is called as mesometrium. So these are the parts of that of the broad ligament only. So when you see on either side, that is only the parts of that of the broad ligament. The broad ligament consists of three parts: mesoovarium, mesosalpinx and mesometrium. Next, after the body, the next thing what you would be seeing is that of the cervix part. So what we are saying, this is that of the cervix. The cervix extends from, so what we are saying is the internal os. This is the junction. This is the fund above is that of the body of the uterus, beneath is that of the cervix of the uterus. So this is the junction or the isthmus. So isthmus is that which separates from that of the body from that of the cervix. So at this the isthmus part, which is a constricted part, we get to know that of your internal os. So this is the internal os which will be present at that of the junction. So this is the cervix what you will be seeing. So beneath this what you are seeing is a cervix which is about 2.5 centimeters in length. So this is a 2.5. The cervix continues down as that of the vagina. It continues down as that of a cylindrical part which is called as that of the vagina. And this os what we are seeing is the external os. So this is the os, this is the internal os of the uterus, and this is the external os. When we see, and this is the external os which is communicating with that of the vagina. So it communicates and opens into that of the vagina. Yes, and this is that what we are saying: anterior wall, posterior wall, two lateral walls which are called as fornix of that of the vagina. Vagina consists of anterior. You can see beneath this wall, this is a posterior wall. Either side which is called as two lateral side, lateral fornix, we will be saying it. So these are called as that of the parts of the vagina. So cervix opens into that of the vagina. Yes, so this wall what you are seeing, yes, as I am saying, so there is a posterior wall of that of the vagina is present, and this you can see that of the os. This os is called as the external os. The external os itself, this os communicates above with that of your uterine cavity. This is the uterine cavity, cervical canal. From the cervical canal through internal os, you can see the cavity of the uterus. So this is the cavity of the uterus. The cavity of the uterus, when you see the section, coronal section of the cavity, it is triangular in shape with the apex pointing towards that of the os, that is the external os or the internal os, whereas base is towards the fundus of the uterus. So this is triangular in shape. When you say take the section of the cavity of the uterus, it is triangular. The base towards the fundus and the apex is towards that of the os, that is that of the internal os. So it is triangular in shape. Now after this, when you see here, so when you see above, the one thing that you have to remember is within that of your fundus there is no cavity. That cavity is absent in that of the fundus. The uterine cavity, what we have said here, it is absent at that of the fundus, so at the fundus part. Next, coming to that of the, when you have seen here the position of the uterus, we have said it is oblique. When you have showed the position of that of your uterus, so this part is the cervix part. Yes, this is the isthmus and this is the cervix. This cervix is divided into that of the supravaginal and the vaginal part. Supravaginal and the vaginal part. The supravaginal part of the cervix is related to that of the urinary bladder, that is the base of the urinary bladder in front, and behind it is related to the intestines. Whereas when coming to that of the vaginal part, here you can see the vaginal part of it is related to that of the external os. So this is the external os. So this is about that of the cervix. Within the cervix you can see the cavity which is called as that of the cervical cavity will be present. One thing, as we have said earlier, the position of the of your uterus is oblique in our body. So in the body it is the oblique. That obliquity, so anteversion and anteflexion. So we have said the fundus should be present forward, whereas the anterior surface should face forward and downward, posterior surface backward and upward, means it is in oblique position. The obliquity, the importance of that of obliquity is, if this position is not maintained, there might be the prolapse of the uterus can happen. So the prerequisite or for the uterus in the body is it should be present obliquely in the body. In this position only it should be present. So to be in this position, that is anteversion and anti-flexed position, the things which are helpful to maintaining the position of the uterus is, as we knew, these are the ligaments, that is false and that of the true ligaments. So the false ligaments, that are the folds, that are the peritoneal folds, as we have said, that is vesicouterine fold, rectouterine fold, these are the Douglas pouch, these are the folds. Other than that, there are other true ligaments also, which are called as fibromuscular ligaments, and because of these ligaments this obliquity is maintained. If this obliquity is not present, normally what happens is a prolapse of the uterus. Prolapse of the uterus can happen, because of which the prerequisite here is the obliquity should be maintained as a position of the uterus. So this is about that of the uterus. And coming to that of the blood supply, and this, the blood supply, as we knew, it is supplied by uterine and the ovarian vessels. Venous drainage is, it is into the internal iliac vein, into the inferior vena cava. Nerves is sympathetic and parasympathetic. But this is about that of the gross, the thing. Whenever you are saying about the uterus, the main thing that you have to know is the position of the uterus. What is the position? Anteversion and anteflexion. Now next, about that of the parts of that of your uterus: fundus, body, and that of the cervix, which is continuing as a vagina. One more thing, when you see the uterus, anteriorly and laterally, laterally it is communicating with that of the, when you see here, it is communicating with the uterine tubes. At the lower part, through that of uterine cavity, through the internal os, into the external os, it is communicating with that of the vagina. So this should be about the thing of that of your uterus. Yes, any doubts ma, you can ask, because there is WhatsApp group. Stay safe, stay secure. Thank you.